Goeienaand. Good evening, fellow South Africans and citizens of the world. And if you wanted any evidence that Ramaphosa's addresses to the nation were pre-recorded, well, I'm going to give it to you because I came across something really interesting. It's Ramaphosa's speech, which is supposed to be being made at 8 p.m. tonight, which is already up on the internet. So we're going to watch his speech before he actually says it. How's that? First here on the Loving Life channel. Here we go. Enjoy.
Deaths. More than 51 million people have been infected globally, and at least 1.2 million people have died. Many countries are in the midst of a second wave of infections, which has often been more severe than the first. What we are seeing brings home a very difficult truth, that COVID-19 is far from over. It is very much still here, and it will remain with us for some time to come. As South Africans, we have endured what we hope is the worst of the storm. At the height of the pandemic in July, we were recording around 12,000 new cases of infections a day. For more than 2 months now, the number of new infections has remained relatively stable at below 2,000 a day. The number of deaths has been declining steadily, as has the number of people requiring hospitalization. The total number of new hospital admissions has also declined for the 14th consecutive week. We owe this to the decisive measures that we took early in the pandemic and to the contribution that every South African has made in fighting this virus. We owe this also to the frontline workers who have selflessly and steadfastly and also courageously staffed our medical facilities, gone out into communities to screen and to test, who have also had the courage to continue serving our people. And in doing so, we know that our people have benefited a great deal. For more than 2 months now, yes, the virus has declined significantly. And as it has declined, we have also been praised by many people around the world. We should be proud of our response as a nation, which has been widely recognized and been commended. I had a virtual meeting yesterday with several international business leaders whose companies operate in many countries across the world. They all applauded the manner in which South Africa has managed the pandemic. While this is welcome progress, we must, however, acknowledge that this pandemic has so far taken a great toll on the health and well-being of our people. To date, South Africa has recorded more than 742,000 coronavirus cases. Of these people, over 92% have recovered from this disease. This is a phenomenal achievement. But the greatest blow we have suffered since the start of this pandemic are the confirmed deaths of 20,011 people due to COVID-19. While we have a relatively low fatality rate compared to many other countries, we cannot begin to calculate the loss as well as the anguish that these deaths have caused to families and to the friends of those who have departed. Since the beginning of this crisis, our goal has been both to save lives and to protect the livelihoods of South Africans. As we rebuild our economy in the midst of this pandemic, this must remain our overriding concern. Although infections have stabilized, many people are still getting infected every day, and we remain vulnerable. We are seeing now how quickly and how dramatically infections can rise in a number of countries. We are also seeing how health systems can become overwhelmed in the face of rising infections. The rise in infections in some of these countries has led to the reimposition of tough restrictions. We have also seen in other countries how a resurgence can dash the hopes for a swift economic recovery. We must do everything that we can to prevent this from happening in South Africa. If we are to prevent a resurgence of infections in our country, there are a few areas that we must pay attention to. The first is the situation in the Eastern Cape, which is showing signs of a resurgence. In the last week, the number of new cases in the province was 50% higher than the week before. This is concerning. And the total number of new cases in the last 14 days was around 145% higher than the previous 14 days. These increases are being driven by massive spikes in the Nelson Mandela Bay Metro and the Sarah Baartman district in particular. For the last month, there has been a sustained upward increase in hospital admissions in the province. The evidence suggests that the increases in the Eastern Cape could have been triggered by outbreaks in institutions of higher learning, such as universities, and also in schools, and attendance by people at large gatherings. When this is combined with poor adherence to social distancing, mask wearing, and other poor hygiene measures, the environment is for rising infections is set. With many people moving between the Eastern Cape and other provinces, particularly the Western Cape, it is a matter of time before this surge spreads to other parts of the country. We therefore need to take measures to contain these rise in infections. In response to the rising infections, we are implementing the resurgence plan that has been developed together with the surge team that was deployed to our country by the World Health Organization. Interventions that we have come up with include primary healthcare outreach teams to intensify contact tracing, daily community mobilization, ensuring the readiness of health facilities in the province, and being ready to respond to possible cluster outbreaks. We will be working closely with the provincial government, also with municipalities and other institutions in the Eastern Cape in the coming days and weeks to ensure that this surge is contained and managed. What we are witnessing in the Eastern Cape should, in essence, be a wake-up call to all of us that we cannot relax and we cannot be complacent about our approach to COVID-19. We are therefore also closely monitoring developments in areas that are experiencing higher than average rates of new infections. The areas where we are experiencing higher than average rates of new infections include Lejwe Leputswa and Mangaung in the Free State, Francis Bard and Pixley Kaseme in the Northern Cape, and the Garden Route and Cape Town Metro in the Western Cape. To ensure that we can keep all the necessary prevention measures in place, we are, as required by the Disaster Management Act, extending the national state of disaster by another month to the 15th of December 2020. The second area of concern that we need to pay attention to is the upcoming festive season in our country, during which time many South Africans travel to other parts of the country and where people tend to relax and to gather socially. These activities, if not undertaken responsibly, pose the greatest immediate threat to our management of the pandemic. But we can avoid a second wave if we each play our part, if we remember what we need to do to keep ourselves and others safe. From the big cities and the metros to the smallest towns and villages, we all know about this virus. Information about this virus has been abundantly socialized among South Africans. From the grade R learner to the factory worker, from the university student to the grandparent at home, we all know how the coronavirus can be spread. So what I'm asking of each and every one of you this evening is not something new. I'm asking you to do what we all know must be done. We know that this virus is transmitted when we are in close contact with other people. Let us remember that it is transmitted in small particles from our noses, from our mouths, when we speak, cough, sneeze, or even breathe heavily. We also know that we need to protect ourselves and those around us. We also know that we need to wear a mask. A cloth mask worn over the nose and the mouth is still one of the best defenses against the spread of coronavirus. Now, I know that this can at times be a hassle. Masks can be hot and they can be cumbersome and uncomfortable, particularly during the summer months. Masks also make it difficult to recognize other people or to hear clearly what they are saying. I've also had difficulty in recognizing some people when they are wearing masks. But cloth masks are cheap. They can now be found almost anywhere in our country, and the inconvenience of wearing one is far, far, far better than becoming infected or infecting others. Wearing a mask every time we leave home is far, far better than having a second wave. It is also far better than a return to lockdown and better than having to shut down our economy once again. A number of outbreaks have been linked to indoor gatherings where there is poor ventilation and where there is no social distancing. Of course, with the festive season approaching, it is understandable that we all want to be with family, we want to be with friends, It has been a stressful and traumatic year that we've all gone through. We want to socialize, we want to connect with each other, and forget the troubles and tribulations of 2020. But this does not mean that we should let our guard down against this virus. We must remember that every additional person we come into contact with increases the chances of transmission. We should seriously avoid large gatherings. We should rather meet in small groups, and if we go out, we should limit contact with others. I have personally been increasingly getting concerned and alarmed by what I keep seeing in social media and on television, where people are holding big parties, where they go to big gatherings and social events as though the virus does not exist, where they go to shebeens and taverns and dance up the whole night as though the virus does not exist. I've been seeing images of indoor venues crowded with people who are not wearing masks and with no evidence of social distancing. These are super spreader events that must be avoided because this is dangerous behavior. The same rules that applied in the early days of the lockdown should also apply now. And now that we are in summer, it is far easier to meet outdoors or in rooms with windows that are open to allow ventilation to come through the rooms. As we have said before, we need to utilize various tools in our coronavirus toolbox to fight this virus. We can also use technology to fight the virus. I call on every South African to join the 700,000 South Africans who have downloaded COVID Alert as a mobile app. The COVID Alert app can notify you if you have been exposed to the virus, whether it is in a taxi, a shopping mall, or a social gathering. And it does so without sharing your location or any of your personal information. The app is zero-rated by mobile networks, so it won't cost you anything to protect yourself and others. By downloading this app, you help to make the virus visible and break the chain of transmission. We would like, therefore, to appeal to all organizations to encourage their staff, to encourage their visitors, to download the app when they enter their offices, their shops, their schools, universities, or other enclosed facilities or spaces. In addition to these actions, we should all take to prevent a resurgence. We are strengthening our public interventions with regard to health. Testing is essential if we are successfully to prevent a resurgence. Without the severe capacity constraints we have had a few months ago, we are now working to significantly increase the number of tests that are done each day. All hospitals, both public and private, should test hospitalized patients in line with the revised guidance. We will also be expanding community screening and testing in hotspot areas. An effective and safe vaccine is still our greatest defense against COVID-19. And there are now several candidate vaccines in development across the world. Equitable access to an effective vaccine is vital to the successful containment of this pandemic. Earlier this week, the world witnessed a game changer in the world of science regarding the development of a vaccine. This is the first evidence that an effective vaccine against coronavirus is possible, and that the preliminary data from the research suggests that it may be more than 90% effective. Now, this changes our perspective on the future of the coronavirus pandemic. This development brings new hope in our fight against the virus. South Africa is collaborating with several multinational pharmaceutical companies to obtain a safe and effective vaccine for our people, and we are contributing towards the availability of a vaccine in the rest of the continent. We are working through the Africa Centers for Disease Control and Prevention to acquire and to fund a vaccine for the African continent. It is estimated that our continent, Africa, will need around $12 billion and 750 million doses of an effective vaccine. Earlier this week, in my capacity as chairperson of the African Union, I established the COVID-19 African Vaccine Acquisition Task Team to lead this effort. Our Minister of Health, Dr. Zweli Mkhize, will serve on this task team together with other outstanding citizens of our continent. South Africa has also been appointed as a co-chair of the global ACTA initiative that is facilitating access to innovative interventions, including vaccines, for all countries. Countries are going to have to allocate funding so that there can be access to vaccines to prevent the further spread of the virus. In recognition of our country's manufacturing capacity, one of the leading pharmaceutical companies in the world, Johnson & Johnson, has entered into a preliminary agreement with a local company, Aspen Pharmacare, to manufacture and package its candidate vaccine. Aspen has capacity to manufacture 300 million doses of the candidate vaccine at its Nelson Mandela Bay plant in Port Elizabeth. This life-saving medical product will be needed across the world, and it will be manufactured here in South Africa by South African workers. And obviously, we are bidding very hard to have an uptake of the product that will be produced here in our own country. This is in addition to the progress made by BioVac, a local biopharmaceutical company that is in partnership with the South African government. BioVac is in advanced discussion with an international vaccine manufacturer that would also enable it to locally manufacture a COVID-19 vaccine to ensure sufficient supply for our country and to our continent. Fellow South Africans, from the outset of this crisis, we have sought to both save lives and protect livelihoods, as we have said. That is why in April we introduced a massive economic and social relief package to limit the effects of the pandemic on companies, on workers, on households, and on our communities. This intervention was essential to keep our businesses afloat, to protect jobs, and to prevent millions of people from going hungry. Now, as our economy has been steadily opening up and that restrictions are being lifted and movement and activity has been eased, we have been able to turn our attention from these emergency measures towards an ambitious plan of economic reconstruction. Through the various interventions that we are making to deal with COVID-19, we are also shifting from relief to recovery. As the economy starts to recover, many of the measures in the relief package are steadily being wound down. We are trying within our limited resources to ensure that this is done in a gradual manner. We recognize that some industries are still not able to operate fully and that it will take some time for many jobs to return. That is why we extended the special COVID-19 grant for a further 3 months until January 2021. This will provide much needed income to around 6 million people who are unemployed and who do not receive any other form of government assistance. Following extensive discussions with our social partners, the UIF will extend the COVID-19 UIF TERS benefits scheme by another month to the 15th of October 2020. Discussions continue with our social partners on support measures for businesses in distress going forward. Always mindful of the need to ensure that the UIF has sufficient funds to meet the anticipated rise in unemployment claims that will definitely come. The COVID-19 UIF scheme has already paid out nearly 53 billion to over 4.7 million workers. These relief measures were necessary to protect those who are most vulnerable in a time of great distress, but they will have to come to an end, as we do not, as a government, have sufficient resources to continue. The relief package has laid the foundation for a robust economic recovery, limiting job losses and keeping afloat many businesses that would otherwise have been forced to close. As we transition to a new phase in our response, the only way forward is a rapid and sustained economic recovery. We are therefore working to enable all parts of our economy to return to full operation as quickly and as safely as possible. We are amending the Alert Level 1 regulations to restore normal trading hours, for instance, for the sale of alcohol at retail outlets. We are also opening up international travel to all countries subject to the necessary health protocols and the presentation of a negative COVID-19 certificate. Now, by utilizing rapid tests and strict monitoring, we intend to limit the spread of the infection through importation by those who will be traveling to our country. We expect that those measures that we are going to take will greatly assist businesses, particularly in the tourism and hospitality sectors. We are focusing relentlessly on the implementation of our plan, pursuing a few priorities with the highest impact and ensuring that we deliver on these. Our infrastructure program, as announced, continues to gather pace and momentum with the strong support of the private sector as well as development institutions. Many programs supported through the Presidential Employment Stimulus have already started, and recruitment for others has already begun. Among these, the Basic Education Department has opened recruitment this week for teacher and school assistants, targeting unemployed youth in every province. Next week, we will be holding our third South Africa Investment Conference, which is an important indicator on the country's continued value as an investment destination for both local and foreign investors. We're delighted that so many companies that made commitments and pledges in the past are coming back to participate, and new ones want to come back to participate. This is a clear demonstration that South Africa is indeed a land of opportunity and a land where we can still continue to attract investments. We will continue to drive progress on the reconstruction and recovery plan, including through the implementation of structural reforms to shift our economic trajectory. Through our actions now, we can ensure that we remain on the path to recovery. My fellow South Africans, we have lost many lives to this pandemic. Many of us have had to bid farewell to a loved one, a friend, or a colleague. As we look back on the year, it's been a year of much pain and sorrow. It is important as a nation that we should honor and remember all those who have succumbed to this disease. It will be appropriate, therefore, that during the 16 days of activism for no violence against women and children, which is the second pandemic we are confronting in our country, as I said, that we should demonstrate our remembrance of all those who have departed due to COVID-19, but also due to gender-based violence. Cabinet has decided that from the 25th to the 29th of November, the nation should embark on 5 days of mourning for the victims of COVID-19, as well as for the victims of gender-based violence and femicide. We will let the national flag fly at half-mast throughout the country from 6 a.m. to 6 p.m. from Wednesday, the 25th of November, to Sunday, the 29th of November. We call upon all South Africans to wear black armbands or other signs of mourning to signify our respect for those who have departed from amongst us. We call upon all South Africans to demonstrate their solidarity and to do this in remembrance of our countrymen and women, in recognition of the grief that we share as a nation, and as an affirmation of our determination to overcome this devastating disease. Fellow South Africans, as I address you this evening, the country has just received the deeply sad news of the passing of the outgoing Auditor General of our country, Mr. Kimi Makwetu. During his time as Auditor General, Mr. Makwetu served this country with dedication, with distinction, and with great integrity. Our thoughts and prayers are with his family at this time of great sorrow. As a nation, let us continue to do what we know we must do to keep ourselves safe, but more importantly, to keep those close to us safe as well. Let us continue to demonstrate that we are a people of resilience and courage. Let us show that we care for one another in sorrow, in sickness, as well as in death. It is our individual actions over the next few weeks and months that will decide the fortunes of our nation. The actions we must take are straightforward, but they are not insignificant. They can and do save lives. Let us continue to work together like the great South African family that we are, to restore, to recover and to rebuild. May God bless our beautiful country, South Africa, and protect her people. I thank you.
Right. That was Ramaphosa talking on the 11th of November. And the reason I ran that as a lead up to his live stream tonight at 8 p.m. is so that you can just get the message that he kind of repeats himself every time he addresses the nation. And there's not much that he actually says in the speeches that is really newsworthy. I would like to address his comments about the vaccine, and I notice there are a lot of comments in the side chat about the vaccine. Let me assure you that the vaccine is not going to be good. Moderna, which is a pharmaceutical company owned by the Bill and Melinda Gates Foundation, is developing stuff in the vaccine which would make your skin crawl. It's absolutely disgusting. They've got a nano product in there called messenger RNA, for example. Now, messenger RNA actually plays with your DNA. It actually alters your DNA. And the thing that is really scary about this vaccine is that the Bill and Melinda Gates Foundation have got patents on things like this messenger RNA. So once you've had the vaccine and your DNA has been altered because you've had it, who owns your body? Because they've got the patent on your DNA. I'm talking about Bill Gates. This is like the biblical mark of the beast. And then you've got fetal stem cells as part of the vaccine. You know, the stuff they put in there, the chemicals they put in there to actually get this vaccine to work, we don't even know if it does work, is quite extraordinary. And it's quite disgusting. I can tell you right now, I'm not going to have the vaccine. If you're going to avoid the vaccine, type 1, but if you're going to go ahead and have the vaccine, type 2 in the side chat. Let's get consensus on what people think about having this vaccine. All right, some of the other issues that we need to look at now, and the Loving Life channel, we put up videos every day, not just about South Africa, but about what is going on with this great global reset. And that's another very, very disturbing area. For those of you who are not aware, there's an organization called the World Economic Forum. Now, the World Economic Forum meet in Davos every year. All the presidents and leaders of the big nations go to this particular conference. The World Economic Forum is run by one Klaus Schwab. I see clearly that most people are going to not have the vaccine. Well, good on you. Although it probably means that you won't be able to travel overseas. Well, that's just a small thing to pay. But getting back to the World Economic Forum, Klaus Schwab is on record saying publicly that in 2021 there's going to be a global reset which will lead to one world government and one global currency. And basically that currency will probably be a digital currency. They're probably going to put a chip in your hand. In fact, I think that's how it's going to work, is there's going to be a chip in your hand which will then be your bank. You know, your currency will be in your hand. And of course, that way they can completely control you. We're talking about biblical times, end times. It's quite extraordinary. As I say, if you go and have a look at my earlier videos, just in the last week, you'll see all the evidence of what I'm talking about. Let's just have a look and see what's happening in the side chat here. Stronger says, I closed all my First National Bank accounts today. Congratulations, great move. Now, the reason I've been calling for my subscribers to get out of First National Bank or FNB is because they have been targeting the farmers, the commercial farmers who have been battling. And what they've done is quite disgusting. They've actually revalued their land from 80 Rand per hectare down to 80,000 Rand a hectare down to 30,000 Rand a hectare. And because the revaluation makes them technically bankrupt, they're calling up their loans. It's quite extraordinary what's going on. And we have a lot of farmers who follow this channel, and we're in there fighting for them, and we're advocating for people to boycott First National Bank. Just get out of there if you can and go to another bank. Just send them a really strong message. And once again, all the information about what I'm talking about here is, if you go and have a look at my earlier videos, you'll see where I say boycott First National Bank, and you'll be able to see why I'm saying that. All right, guys, we've got about 3 minutes to go before Ramaphosa is supposed to come live with his latest speech. So get ready for the message. Yeah, just getting back to what else Ramaphosa was talking about. He was suggesting that a lot of people are coming to South Africa to invest. I've seen no evidence of that at all. But then we do call Ramaphosa Pinocchio, because you know what Pinocchio does. All right, now I'm just going to check, guys. I'm just keeping an eye on the ball here. No, he hasn't come in yet, but he's coming through now. Here we go. I'm going to put it on now. Give me a second. We'll just get this up so it's ready to go. Okay, I'll just keep talking while we wait. I'll just turn this down a little bit. Now, don't forget, after Ramaphosa's speech, we will be talking directly to a lady who has had her Provident Fund stolen, basically by Liberty Life, and well, she alleges it's been stolen. And if you've got a pension in South Africa, I do suggest that you follow that, because I think you'll find it quite interesting. Okay, let's see here. Okay, we're still waiting for Ramaphosa to come on, but it should be any second now, unless he's late. Now, I'm just going to have a look at the side chat to see what's happening here. Okay. They say the Democratic Alliance is... Where's that comment? Gee, this thing is moving so fast. All right, guys, we're just about to go live. Now, those of you who think they're going to lock us down during the festive season, please put 1. And if you think that they're going to loosen the ties a bit, please put 2. Okay, here we go. I'm going to now cross to Ramaphosa live. Okay, apparently he's going to be on in the next 60 seconds. I'm just waiting for that to happen. But okay, so if you think they're going to make the lockdown stronger over the festive season, please type 1. If you think they're going to make it looser or easier to actually be with family and friends, please type 2. Let's see what the consensus is on that. Okay, so most people are suggesting that they think they're going to make it tighter. Well, I guess tonight we're going to find out, guys. Tonight we're going to find out exactly what Ramaphosa's plans are. Now, we know that the NCCC basically runs South Africa at the moment. I'm talking about Dlamini Zuma, Ramaphosa, and that small number of ministers. If you think the NCCC is unconstitutional and should be disbanded, please type 1. And if you think that the NCCC is doing a great job, please type 2. Now, Veritas says, we all wish to disconnect from the global world order ruling over us. It is difficult to accomplish in urban settings. For those of us living in rural areas, it is easier to go off the grid. Yeah, look, there's one great reality, guys, and that is that we've got to start depending on ourselves. We really can't depend on government because the government is completely cactus. And that's not just in South Africa. I can tell you here in Australia, we have exactly the same problem. Okay, I can see most people are saying the NCCC should be disbanded. I get it. I mean, can you imagine Dlamini Zuma's running the country de facto, even though Ramaphosa is supposed to be president? Quite extraordinary. Thanks, Hein. I appreciate that. He's just said I've sent you an email. By the way, just in case you do have something you'd like to send me an email, I'll just put that in the side chat for you. That's my email if you want to send me something that is of importance. Here we go. Yeah. Now, when we talk about the New World Order, this is not a conspiracy theory, guys. The New World Order is very real, and the World Economic Forum is right at the pinnacle of it. And here we go with Cyril Ramaphosa.
Goeienaand. Di Madekwana, Riperile, Sanbonani, Dumelang, Lochani, my fellow South Africans. Tonight I wish to speak to you about the current state of the coronavirus pandemic in our country. But before doing so, I wish to express my profound appreciation to all South Africans who observed the 5 days of mourning from the 25th to the 29th of November in honor of those who have lost their lives to COVID-19 and to gender-based violence and femicide. As we remember them, let us pledge that we will do everything within our means to contain these two pandemics and continue saving lives. The global pandemic continues to cause devastation across the world, with more than 64 million infections and nearly 1.5 million confirmed deaths in a number of countries, including ours. We've seen many countries around the world experience a resurgence of the coronavirus, some with second waves even worse than their initial peak. Where South Africa once had the 5th highest number of infections in the world, we have now fallen to 14th in the world as infections in other countries, these have surged dramatically. And yet, despite the progress we've made, we've always known that a second wave of infections is possible in our own country if we do not take the necessary measures to protect ourselves and those around us. There is now clear evidence of a resurgence of infections in parts of our country, which, if not confronted decisively and directly, could lead to great suffering and death. This pandemic has already taken a heavy toll on our country. A total number of 800,872 people are confirmed to have been infected by the virus in South Africa since March. Around 92% of these people have, however, recovered, and this is good news. As of today, 21,803 people are known to have died from COVID-19 in South Africa. for nearly 100 days since the middle of August, we managed to keep the rate of new infections stable at below 2,000 new infections a day. However, that has changed in the last 3 weeks. There has been a marked rise in new infections and an increase in the number of people being admitted to our hospitals. In the first week of November, we were recording an average of 1,500 new cases a day. By the last week of November, this had almost doubled to an average of around 2,900 new cases a day. Yesterday, South Africa recorded over 4,400 new infections, the largest daily increase in infections since the middle of August. The total number of hospital admissions is now over 5,800 nationally, and it keeps on increasing. 3 weeks ago, hospital admissions were around 4,900. There are 3 areas in our country that account for most of these new infections. I alluded to some of these when I last spoke to the nation. These are Nelson Mandela Bay and the Sarah Baartman district in the Eastern Cape and the Garden Route district in the Western Cape. Hospital admissions in these districts are on the rise. In some instances, they are comparable to those during the first wave of infections. In the Eastern Cape and the Western Cape, there's been an increase in both reported COVID-19 deaths and excess deaths. This must be a concern for every one of us. There are a number of reasons for the rise in transmission. Many people are tending to travel between provinces and within each province in higher numbers, especially with the festive season now approaching. In the case of the Garden Route, this also applies to the movement of seasonal workers who work in one province and live in another province. Social, cultural, and religious gatherings are being held in large numbers. In many cases, these gatherings are often attended by many more people than what is permitted under Level 1 restrictions. What is concerning is that these are also often held in venues or places which have poor ventilation. This is particularly the case for funerals, which are often followed by large so-called after-tears parties. Several hospitals in the Nelson Mandela Bay Metro have reported a rise in alcohol-related trauma admissions. As we have said in the past, these alcohol-related trauma admissions divert our capacity that is needed to deal with COVID-related cases. But by far the greatest contributing cause of infections is that many people are not wearing masks and are not observing proper hygiene and social distancing. As I said during our last family meeting, at alert level 1, we have the measures we need to control the virus. All the tools are in place. But our main problem is that there are parts of our country where people are not complying with the current restrictions and the basic prevention measures are not being followed. The most urgent task before us now is to contain the rise in infections in the affected districts in the Eastern Cape and the Western Cape, and to ensure that a similar situation does not develop in other parts of the country. To prevent this, we are putting into motion the resurgence plan that we developed with the World Health Organization's search team. We are making more capacity available at hospitals and clinics in these areas. We are expanding public health interventions such as testing, contact tracing, isolation and quarantine. We are also stepping up our awareness campaigns around public health regulations. Now, fellow South Africans, we must change our behavior now to prevent a resurgence of the virus and manage outbreaks wherever they occur. If we think of this pandemic like a bushfire, we need to quickly extinguish the flare-ups, the flames, before they turn into a big wildfire like an inferno. At the same time, we need to do all we can to keep the economy of our country open and to push ahead with our reconstruction and recovery effort. In line with our differentiated approach to the management of the pandemic, we will therefore implement additional measures in those areas identified as coronavirus hotspots. When identifying a hotspot, consideration is given to the number of new COVID-19 cases that occur per day, the testing rate within the population, the percentage positivity rate within the population, the number of active cases, the number of hospital admissions, and the number of deaths. This may sound complicated, but it is how we determine what a hotspot is. Now, following a recommendation of the National Coronavirus Command Council, and after consultation with premiers, metro mayors, and traditional leaders, Cabinet has decided to declare the Nelson Mandela Bay Metropolitan Municipality as a coronavirus hotspot. In addition to the existing Alert Level 1 regulations, the following additional restrictions will apply in Nelson Mandela Bay Metro with effect from midnight tonight. The first is that the hours of the curfew will be from 10 p.m. and 4 a.m. This means that, except for emergencies, no person may be outside their place of residence between these times. This does not apply to essential workers who are permitted to work during these hours. Secondly, the sale of alcohol from retail outlets will only be permitted between 10 a.m. and 6 p.m. from Monday to Thursday. Thirdly, alcohol consumption in public spaces such as the beautiful beaches of the area and parks is strictly forbidden. This is necessary to prevent large social gatherings that often take place in those spaces. Fourthly, gatherings, including religious gatherings, may not be attended by more than 100 people for indoor events and 250 for outdoor events. At all times, the total number of people in a venue may not exceed more than 50% of the capacity of the venue, that is the carrying capacity of the venue. And finally, all post-funeral gatherings that are now regarded as after-tears parties are prohibited. These additional measures are necessary to contain the resurgence that we are experiencing right now in Nelson Mandela Bay, to prevent outbreaks resulting from social gatherings and to protect the capacity of our healthcare system to provide care for those who need it. Now, in determining these restrictions, we have sought to take those steps which are absolutely necessary to save lives while limiting disruptions to the economy. Following extensive consultations with traditional leaders, we have agreed that the summer initiation season in the Eastern Cape may go ahead. This is because traditional leaders in the Eastern Cape have submitted a risk-adjusted plan that has been approved by the Departments of Health and Cooperative Governance and Traditional Affairs. This plan includes strict adherence to health protocols, including screening of initiates, the provision of personal protective equipment, and the provision of water for hygiene and to prevent dehydration. However, due to the high rates of infection in the metro, no initiation schools will be allowed in Nelson Mandela Bay. The measures that are being taken in relation to Nelson Mandela Bay are not meant to punish the residents of Nelson Mandela Bay. They are not intended to increase the hardship that is already being experienced by our citizens. These measures are needed to contain the spread of the virus and to save lives. In the coming days, the Minister of Health, Dr. Zwelini Mkhize, will be visiting the Sarah Baartman district and the Garden Route to assess the situation and to engage with various stakeholders in the province. Based on this assessment and the development of the disease in these areas, the National Coronavirus Command Council will determine the appropriate course of action, and if any, that will be announced in due course. To ensure that we maintain the current prevention measures, the national state of disaster will be extended to the 15th of January 2021 in line with the Disaster Management Act. All existing level 1 restrictions remain in force and in place throughout the country. We have all the tools that we need to prevent a resurgence in the rest of the country. We can only do this if every one of us play their part. We can only prevent a second wave if all of us respect the rules, the measures, and the protocols that have been put in place for the protection of everyone. For the safety of all of us, those who break the rules must face consequences. We have instructed law enforcement officials to ensure compliance with the law by owners, by controllers, managers of workplaces, shops, institutions, and buildings to ensure social distancing and wearing of masks and all the other hygiene protocols. Taxi operators are also required to ensure that all their passengers in their vehicles wear masks. In addition, each one of us will be required to comply with the curfew times. Together with the measures to contain a resurgence in hotspot areas, the national effort continues to strengthen public health interventions such as community screening, increased testing, contact tracing, and communication on behavioral change. As we have said in the past, the only viable defense we will have against COVID-19 will be the vaccine. There are now many initiatives around the world to speed up the development of a vaccine. We continue to collaborate with our partners in the international community to ensure that all countries have access to an effective and affordable vaccine so that no one is left behind. We are participating in the World Health Organization's COVID-19 Global Vaccine Access Facility, known as the COVAX Facility, which aims to pool resources and share vaccine development risk and thus ensure equitable access to vaccines when they become available. We are encouraged that the Solidarity Fund that we formed at the beginning of the surge in infections will be making the initial contribution of 327 million rand towards this vaccine procurement on behalf of our country. We are also encouraged by the promising results from 3 trials of candidate vaccines which have shown efficacy levels of between 70 and 95%. We await confirmation from medicine regulators that these vaccines are safe, that they are effective, and that they will be suitable for the needs of our people. In South Africa, our own Health Products Regulatory Authority, SAPRA, will review the approval applications when received from the developers of vaccines and authorize their use. Let us remember that until a vaccine is developed and distributed, we remain our own best protection against COVID-19. It is through our everyday actions that we will keep ourselves and others safe. And I need to keep on repeating this message, that it is through wearing a mask in public at all times that we will be able to keep ourselves safe. It is also by observing social distancing and avoid large gatherings and indoor spaces where ventilation is poor. It is through regularly washing or sanitizing our hands. I know we may get bored with the repetition of the same message, but I'd like this message to sink. I was recently most impressed that a 4-year-old little girl was repeating exactly the same message and telling adults what the president has been saying. So the message does need to be repeated so that it sinks into our subconsciouses. We can also protect ourselves by downloading the COVID Alert mobile app that can notify us if we are exposed to the virus and thereby help to break the chain of transmission. It is extremely encouraging that the COVID Alert SA app has now been downloaded by more than 1 million South Africans. If you have not yet downloaded it, you are one of those who are being left behind. If there is anything this pandemic has taught us, it is the danger of becoming complacent and relaxing. Across the world, countries with declining infections have eased restrictions only to experience a second and even a more severe wave, forcing them to reimpose restrictions on movement, on gatherings, and on economic activity. If there ever was a time for caution, this is the time. The festive season is approaching. Schools and places of higher learning have closed for the summer holidays. Many of us are winding down at work and will soon be at home with our families. Many of us are preparing to travel to reunite with friends and family. Traveling carries great risks. which we can reduce by avoiding unnecessary travel. We can also reduce infection risk by wearing a mask in public transport, keeping the vehicle windows open, and maintaining prevention measures on arrival. The summer season is traditionally a time for social gatherings, where we attend festivals and fun events and socialize at weddings, religious gatherings, and in both public and private spaces. These social gatherings, fellow South Africans, can be super spreader events that carry a huge risk of transmission of the virus. This is being experienced by many countries across the world. Each of us needs to ensure we take precautions to avoid spreading the virus to our families, especially our elders. We should keep gatherings small. We should have them outside or in well-ventilated venues. We should ensure social distancing and continue wearing our masks as much as possible. We must remember that as much as we want to relax, this virus does not relax. And this virus does not take a holiday. This 2020 has been a difficult year for us as a nation and as a country. It has severely tested our resolve and demanded great sacrifices of each and every one of us. But even as the holidays approach, we cannot let our guard down. Unless we take personal responsibility for our health and the health of others, more people are going to become infected. More people are going to die. Over the last 8 months, many people have lost parents, siblings, spouses, friends, and colleagues to COVID-19. As a nation, we have lost many brave frontline workers who are caring for those in hospitals and our clinics. We have lost essential service workers who helped to keep this country running, moving, and operating during the lockdown period. We have lost teachers who went to school every day to support our children and to ensure our matriculants were able to write their final exams. We owe it to all those whose lives have been so tragically cut short by this deadly virus not to let the same suffering and pain be visited on even more families and more of our people. We owe it to our own friends and relatives and those around us. We owe it to our country, because a resurgence of the virus would be a severe blow and a setback to our emerging economic recovery, to our efforts to restore and create jobs, and to our provision of services to our people. Most of all, we owe it to ourselves and each other, because this affects all of us. Tonight, we stand in solidarity with the people of Nelson Mandela Bay Metro as they work to contain this outbreak. I have the utmost confidence that Premier Oscar Mabuyane and the leadership of the Eastern Cape is doing and will do all that is necessary to bring the rate of infection down once again. I call on each and every one of you to remember those whose lives have been lost and the precious lives we still have to save. Over the past 8 months, we succeeded in bringing the virus under control by acting together and working hand in hand. We fought this pandemic with everything that we had. Through our combined efforts, we saved many thousands of lives, which would otherwise have been needlessly lost. Now, as the number of infections begins to rise again, we must not sacrifice the gains that we have made. We cannot return to the darker days of June and July. You remember? When transmission of the virus was widespread and scary, and the lives of our families and friends were at risk. Just as we know that a second wave is possible, we know too that it can be avoided. So tonight, I'm asking you to recommit yourself to this fight. We're in a fight of our lives. We can still prevent the virus from spreading any further if we take the appropriate steps now. Just as we did in the early days of the pandemic, let us stand together and let us work together. We will get through this period of difficulty as we did the ones before. May God continue to bless our beautiful country, South Africa, and protect all her people. I thank you.
All right, guys, I don't know what you thought of that, but I thought it was a lot of toddle. I could use a ruder term, but I'm not going to. Okay, now, guys, in about 10 to 15 minutes, we're going to be going live again with Jean. Now, Jean is a pensioner, and she is alleging that Liberty Life have done something very, very strange to her Provident Fund. And we're going to be discussing that tonight. And every night at 8 p.m. Johannesburg time, we have live streams and we cover a wide range of subjects. If you go to the Loving Life homepage and the minutes before we go live with Jean, you'll see I've actually got a playlist right near the top called live streams. You can see some of the subjects we cover, which is pretty well everything. So please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video and please share this video with your friends, and please, 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 please join the Loving Life family. We've got nearly 100,000 subscribers now. Come and be part of the family and find out what is going on in South Africa if you don't come from South Africa. All right, guys, I'm going to terminate this live stream now, and as I say, in about 10 to 15 minutes time, on this Loving Life channel, we'll be going live again with Jean to talk about how her pension or her retirement money has been kind of just went for a big walk with Liberty Life. But that's the allegation. All right, see you shortly, guys. Take care and have a great evening.